Yeah, it's fine. You can start.
Okay, hello. My name is Oana Nicoleta Buliga-Finis. I'm from Romania. I'm a specialist in internal medicine at the hospital Sant Spiridon in Iași, Romania. I'm gonna present you interesting subject about cardiorenal syndrome and to be more specific, treating anemia, the point of convergence for heart failure and chronic kidney disease. Cardiorenal anemia syndrome represents the pathological triad in which the vicious relationship between chronic heart failure, chronic kidney disease, and anemia is associated with increased morbidity and mortality and decreased quality of life. Anemia is a common condition in patients with advanced heart failure and chronic kidney disease and has a prevalence in cardiorenal syndrome from 5 to 55%. Anemia leads to progressive renal and cardiac dysfunction and exacerbate both cardiovascular disease and chronic kidney disease. The decrease in erythropoietin production in the oxygen transport leads to tissue hypoxia, peripheral vasodilatation, stimulating neurohormonal activity, and maintain cardiorenal syndrome pathological cycle. In the cardiorenal syndrome, we observe a prevalence of anemia as glomerular filtration rate decrease from chronic kidney disease 1 to 5 stage to about 21% to 70%. And in heart failure, as new heart association class 1 to 4 to 9 to 79%. There are many therapy, but there are no guideline practice for cardiorenal anemia patients. We can use intravenous iron therapy that has an important role in the management of anemia, being beneficial for patients with both heart failure and chronic kidney disease. We can use erythropoiesis stimulating agents combined with intravenous iron that increase hemoglobin levels and stabilize creatinine levels in patients with cardiorenal syndrome. But only 5% of patients with cardiorenal anemia syndrome are eligible to this therapy due to the thromboembolic complication here. Generation of endogenous erythropoietin and lowering the fibroblast growth factor 23, hypoxia-inducible factor prolyl hydroxylase inhibitor are a new class and are promising agents for cardiorenal anemia syndrome. A new class of agents, the hepcidin antagonist and their effects on renal and cardiac function could become a new potential therapy for this complex syndrome, as studies suggest. In patients with cardiorenal syndrome and anemia, intravenous therapy with iron sucrose gives good results for 6 weeks increased hemoglobin levels, similar with weekly subcutaneous erythropoietin beta. The erythropoiesis stimulating agents lead to increase in hemoglobin and hematocrit, but also increase C-terminal fibroblast growth factor 23, which is associated with increased risk of mortality. HIF inhibitor have direct effects on iron metabolism, reducing the serum hepcidin and cholesterol levels, and may improve heart and kidney function. As conclusion, anemia therapeutic strategies diminish the loss of kidney and heart function of patients with cardiorenal anemia syndrome and improves the prognostic and clinical outcomes. As we can see in the diagram with the red color, the good results after treating this complex syndrome.